Let's clear the air right away. You can't get HIV from kissing. It's a common misconception, but HIV, the virus that causes AIDS, is not transmitted through saliva. Hugging, shaking hands, sharing utensils, or using the same toilet seat won't give you HIV either. These are all forms of casual contact that don't pose a risk. HIV is a delicate virus that can't survive outside the human body for long. It needs specific fluids and modes of transmission to spread. Understanding how HIV is and is not transmitted is crucial to fighting stigma and supporting those living with the virus. HIV transmission occurs through specific bodily fluids: blood, semen, vaginal fluids, rectal fluids, and breast milk. These fluids carry the virus from one person to another, making it crucial to understand how transmission happens to prevent the spread of HIV. These fluids must come into contact with a mucous membrane, damaged tissue, or be directly injected into the bloodstream for infection to occur. Mucous membranes are found in various parts of the body, including the rectum, vagina, penis, and mouth. Damaged tissue can be a result of cuts, sores, or other injuries, providing an entry point for the virus. The primary modes of transmission are through unprotected sex, sharing needles, mother-to-child transmission, blood transfusions, and needle stick injuries. Understanding these modes is essential for taking preventive measures. Unprotected sex. Having vaginal or anal sex without a condom significantly increases the risk of HIV transmission. Condoms act as a barrier, preventing the exchange of bodily fluids that can carry the virus. It's important to use condoms consistently and correctly to reduce the risk. Sharing needles. Injecting drugs with shared needles is a highly risky behavior. When needles are shared, blood from an infected person can remain in the needle and be transferred to the next user. Using clean, sterile needles every time can prevent this mode of transmission. Mother-to-child transmission. HIV can be passed from mother to child during pregnancy, childbirth, or breastfeeding. However, with proper medical care and antiretroviral treatment, the risk of transmission can be significantly reduced. Pregnant women with HIV should work closely with their healthcare providers to manage their health and reduce the risk to their babies. Blood transfusions. Though rare today due to rigorous screening, HIV can be transmitted through infected blood transfusions. Blood banks and hospitals follow strict protocols to screen donated blood for HIV and other infectious diseases, making transfusions much safer than in the past. Needle stick injuries. Healthcare workers are at risk of needle stick injuries, which can transmit HIV if the needle was previously used on an infected person. Proper training, the use of safety devices, and following protocols can help minimize this risk. It's important for healthcare facilities to provide a safe working environment and for workers to adhere to safety guidelines to protect themselves and their patients.